Hi, in this video, we're going to cover a high-yield psych meds you'll definitely see on your exam. Simplified, clarified, and tied to the mnemonics that actually stick. You'll still remember them a month after you're done with your psych rotation. This is going to be about 50 to 60 questions that you will likely encounter, super high yield, rapid fire. So let's begin. What is the mechanism of action of bupropion, Wellbutrin? Wellbutrin inhibits the reuptake of norepinephrine and dopamine, increasing their levels in a synapse, which can help alleviate the symptoms of depression and smoking sensation. So in this type of question, they're going to tell you the patient is taking Wellbutrin, and they may ask you, what is the mechanism of action of this medication, listing 4 different options, and I just say it's all well with norepinephrine and dopamine with Wellbutrin. Which medication can be used for depression and diabetic neuropathy? That would be duloxetine, Cymbalta, which is an SNRI, which is commonly used to treat depression, but it also treats diabetic peripheral neuropathy, which makes it a great choice for patients that are dealing with both of these issues, as it enhances serotonin and norepinephrine levels in the brain and relieves the pain in neuropathy. And the way I remember this, duo in duloxetine, it reminds me of duo effect treats 2 different things, and both of them start with D. So double D, duo. Depression, diabetic peripheral neuropathy, duloxetine. Which antidepressants is known for having the lower risk of sexual side effects? This is a type of question that test creators love to ask about. I've seen this question several times throughout my PA school, and that would be Wellbutrin again. It is preferred because it has the lowest risk of sexual dysfunction compared to other antidepressants, making it a suitable choice for patients concerned about this side effect. And the way I remember that is in Wellbutrin, I always say well and link it from there. And I would advise you to create your own little mnemonics, your own little stories, things that will make it stick for you. This is how I remember things years after school, and it's just because of these little mnemonics, and the rest of the material is usually just a blur. So it's all well with Wellbutrin for sexual side effects. It's all well when it comes to sexual side effects when you take Wellbutrin. Which SSRI has the longest half-life? They can give you 4 different SSRIs and ask you of the following medication, which one has the longest half-life, and that would be fluoxetine, which has a half-life of about 4 to 6 days, making it less likely to cause withdrawal symptoms upon discontinuation. And the way I remember this is fluoxetine, flu. I always associate with the flu, and I say the SSRI flu is long. It lasts about 4 to 6 days. How do SSRIs affect the risk of suicidal thoughts in children and adolescents? Well, it shows that SSRIs can be associated with increased risk of suicidal thoughts and behaviors in children and adolescents, especially in the early stages of treatment, usually the first month. And this is likely due to the fact that they're experiencing more energy, they're feeling better. So if they have those thoughts, they're likely to act upon it more during that first month due to the increased energy. What side effect is commonly associated with Wellbutrin? The common side effect is the seizure. So the Wellbutrin decreases the seizure threshold, especially in the higher doses. And this is particularly in patients with a history of eating disorder and alcohol use disorder. So if they tell you in the question stem that this is, a patient with bulimia, or there's an alcoholic in a stem, and they're asking you which of the following medications should be avoided in this patient when it comes to treating their depression, you should pick Wellbutrin because it decreases the seizure threshold. Which antidepressant is most associated with weight gain? This is a great test question. So they're going to list 4 different antidepressants, and they're going to ask you the following medication, which one is associated with significant weight gain, increased appetite, especially within the first few weeks, and that would be mirtazapine. The way I remember mirtazapine, like mirtazapine sounds like mortazapine, and more means more weight. So I'll just remember mirtazapine, more weight. Anything with increased weight gain, I know is mirtazapine. What side effect is commonly seen with tricyclic antidepressant, TCAs? So TCAs like amitriptyline can cause anticholinergic side effects. And you should know that anticholinergic side effects are dry mouth, constipation, blurred vision, and urinary retention. Those four side effects, anticholinergic in nature, and they may ask in a question stem, of the following medications, which one is likely the cause of the symptoms? And they're going to list a patient presented with dry mouth, constipation, they're complaining about their eyes, they're also having some urinary retention, and you should be thinking about amitriptyline, or you can say AMI has urinary retention. So TCAs, amitriptyline, anticholinergic side effects. What is the serious side effect of MOAs, monoamine oxidase inhibitors? The serious side effect of this medication, such as phenelzine, is that it carries a risk of hypertensive crisis when it's combined with tyramine-rich foods such as cheese and wine or some other certain medication. So in the question stem, they're going to tell you patient presented with a hypertensive crisis. They love cheese, they love wine, they were on a fancy dinner or something. And which of the following medication is likely to cause the hypertensive crisis after the dinner? And that would be MOAs. Or they're going to ask you which of the following foods, vitamins, XYZ, should be avoided in a patient taking phenelzine, and that would be tyramine rich foods. What side effect is commonly seen with fluoxetine, Prozac? And that would be insomnia. So flu, when you're having a flu, you're having a hard time sleeping, right? Because you're congested, you don't feel good. Every time I have a flu, unless you take medication that helps you sleep, you're gonna have a hard time sleeping. So if the question asks me which of the following depression medication is likely to cause insomnia, I'm just thinking when I have flu, I have a hard time sleeping, that would be fluoxetine. Which SSRI is often considered the first-line treatment for depression? That would be sertraline and escitalopram. These are commonly considered the first-line treatment for depression due to the efficacy and the favorable side effects. And cert in sertraline sounds like certain, so I just remember it as I'm certain this SSRI will help. I am certain this medication will help. Which SSRI is associated with the highest risk of sexual side effects? And that would be Paxil, paroxetine, which is associated with more pronounced sexual side effects compared to the other antidepressants, including decreased libido, delayed ejaculation, and anorgasmia. So paroxetine, Paxil, worse side effects when it comes to sexual dysfunction. Which benzodiazepine has been approved for treatment of alcohol withdrawal? So in a question stem, they're going to tell you this patient is alcoholic, going into the alcohol withdrawals, and which of the following medication is approved for the treatment, and that would be Librium. This is especially approved for alcohol withdrawal management, and the way I remember this is very simple. Librium sounds like liberate, and I'll just say liberate yourself or liberate your patient from alcohol dependence. Clozapine is the most effective antipsychotic, but it carries the risk for what? And that would be a granulocytosis. So they're going to tell you this is a patient is taking clozapine and you want to talk to them about the side effects. And one of the worst side effects of clozapine is a granulocytosis. Medication used for schizophrenia with anti-suicidal properties. That would be the clozapine again. So in a question stem, they're going to describe a patient with schizophrenia, and they may have some suicidal agitations, thinking about ending their life, and they're going to ask you which medication is the most suitable for this patient, and that would be clozapine. And you can remember as close clozapine, close the case. What is the problem with using haloperidol, which is a first generation antipsychotic, for treating schizophrenia? So the problem with the haloperidol is the risk of increased extrapyramidal symptoms, EPS. This is rigidity and tremors and so forth, like a motor side effects. And the way I remember this is I would just say Just don't say hello to the schizophrenia patients. If you see a schizophrenia patient, just stay away. Just don't say hello. And hello is for haloperidol. That would remind me that, that causes them rigidity or tremors, or both. What side effect is described by lip smacking and rolling of the tongue in a patient taking antipsychotics? So they're going to describe a patient that is lip smacking, rolling their tongue, and they're going to ask you what is the side effect. And it is tardive dyskinesia, which is a movement disorder caused by a long-term use of antipsychotic medication. And the way I remember this is I would say it's touchdown. Now you can roll your tongue and smack those lips. Because if you notice when there's a touchdown, a goal, or something, people always celebrate. And when they celebrate, they have all kinds of crazy facial expression, rolling your tongue, smacking those lips, whatever the case it is. Or another test question could be, what is the most worried side effect of a long-term use of antipsychotic medication? And that would be tardive dyskinesia. What is the main concern with the use of stimulants medication for ADHD patients? The main concern would be the risk of abuse and addiction. If a patient with ADHD is at risk for substance abuse, how should the ADHD be treated? So a question stem will give you an adolescent patient with ADHD. They're going to tell you he's at increased risk for substance abuse due to their behavior or something else. And they're going to ask you, what is the best treatment for this patient? And that would be atomoxetine, non-stimulant medication, which works by selective inhibiting of the reuptake of norepinephrine, helping improve the attention and impulse control without that addictive potential of the stimulants. Which SSRI is considered the most sedating? And that would be paroxetine. Paroxetine causes more sedation than other SSRIs, and it should be used with cautions in the patients who are prone to drowsiness. Also, they can be very creative and say this is a patient who is elderly, who needs to get up at night several times to use the bathroom, and which of the following depressive medication should be avoided in this patient? And your answer is paroxetine, because you don't want to add sedating medication to somebody who needs to get up at night a lot. So paroxetine, avoid. In elderly, it is the most sedating medication. If a patient is taking Zoloft, sertraline, what supplement should they avoid? And that would be the St. John wort, as it increases serotonin levels in the brain, potentially leading to serotonin syndrome, which is a life-threatening condition causing agitation, confusion, rapid heart rate, and high blood pressure. So in a question stem, they're going to tell you you are prescribing patients Zoloft and you are educating them about all the side effects and things they should avoid. And the one thing they're going to say you need to educate your patient is not to use St. John wort supplement while taking this medication. Which SSRI is associated with the lowest risk of weight gain? A lowest risk would be fluoxetine, which is associated with one of the best treatments for depression, lowest weight changes. And the way I remember this is I'll just say when I have a flu, I really don't worry about weight gain. I don't feel like eating, I feel sick, I feel like just blah. And so flu causes me not to worry about the weight gain. So fluoxetine, less weight issues. Which SNRI can cause hypertension? That would be venlafaxine, which can cause hypertension at the higher doses. A van sounds like minivan, and I would just say driving in a van causes me hypertension. It could be traffic, could be something else. Minivans always just cause me hypertension. Which SSRI is associated with frequent diarrhea? And that would be sertraline or Zoloft. I'm certain that medication caused the diarrhea. Which medication is associated with a neural tube defect and decreased IQ when taken during pregnancy? That would be valproate acid. Use during pregnancy can lead to neural tube defect and a lower IQ in a child. And the way I remember Valproate, I would associate with a name like Valerie, Val for Valerie, and neural tube defect, decreased IQ, and I would say, who had a child with a low IQ and neural tube defect, and I'll be like, Valerie. I think she had that kid, and that would remind me that's a Valproate was used during pregnancy that's causing those symptoms. Will prolactin levels be increased or decreased with the use of risperidone? So with risperidone, prolactin levels will be increased, which can lead to side effects like galactorrhea and menstrual irregularities. So prolactin increased during the time you take risperidone. What is a notable side effect of olanzapine? They're going to tell you in a question stem the patient is taking olanzapine and which of the side effects of olanzapine are likely associated to this presentation, and you should look for diabetes mellitus due to the weight gain and metabolic changes. Or they can say this is a patient that has a newfound diabetes, taking several medications, and which of the following medication is likely contributing to developing of diabetes, and that would be olanzapine. Which SSRI can reduce the binge purge cycle? And that would be fluoxetine, which is the SSRI most commonly used to reduce the frequency of binge eating and purge episodes in a patient with bulimia nervosa. The way I remember this, again, when you have a flu, you don't feel like binge purge eating food and doing all those things. So I'll just say, hey, which one can help me stop eating? And I'll be like, fluoxetine. When I have flu, I don't feel like doing any of those things. Best medication for a schizoaffective disorder. Best medication for schizoaffective disorder is haloperidol or risperidone. Don't say hello to schizophrenia, but you can say hello to schizoaffective. What is the first line medication for performance anxiety? So they're going to talk about special phobias. They're going to tell you this patient is super scared about public speaking or giving a speech, and they may even say this patient is expected to give a presentation at work, and they're just like freaking out. And the question is a beta blocker, propranolol. So the hint that I remember this is take this medication and you're gonna perform like a pro. Pro for propranolol. What is the first line medication for general anxiety disorder? That would be the SSRIs. What is the most commonly prescribed medication for nightmares in a PTSD? So in a question stem, they're going to tell you this is a patient with PTSD that is reporting increased number of nightmares, even worsening their anxiety and everything else they're experiencing. And the question is prazosin. Prazosin, and I'll just say pra sounds like pro. And I'll just say if you want to sleep like a pro, take this medication. No more nightmares. Prazosin, not propranolol. How do we treat benzodiazepine overdose? Benzodiazepine overdose is treated with flumazenil. Flumazenil also has flu in it, and the way I remember it is a flu takes care of benzo overdose. Flumazenil, flu takes care of benzo overdose. What are the most common signs of TCA overdose? Common signs of TCA overdose include dry mouth, blurred vision, urinary retention, tachycardia, delirium, and seizures. These symptoms are due to the anticholinergic and CNS depressant effects of that drug. What are the 3 C's of TCA overdose? The 3 C's of TCA, tricyclic antidepressant overdose: convulsion, coma, and cardiac issues. In a question stem, they can say which of these side effects is most likely associated with the tricyclic antidepressant. Look for 3 C's, and if they really want to get creative, they can say which of the following side effects is not associated with TCA overdose. Look for the one that doesn't start with a C. So convulsion, coma, and cardiac issues. What is the primary treatment for TCA overdose? And that would be sodium bicarbonate, which helps stabilize the cardiac membrane potential and reverse the effects of sodium channel blockade. Activated charcoal may also be used if the overdose occurs within 1 hour. Sodium bicarbonate. How does a TCA affect the heart? So the tricyclic antidepressants can lead to the cardiotoxicity, including arrhythmias, QT prolongation, and ventricular tachycardia due to their ability to block sodium channels and interfere with cardiac condition. Cardiotoxicity, TCA. Which SSRI is associated with a QT prolongation? Oh my god, I see this question several times to PA school. That would be citalopram. It is known to be associated with QT prolongation as a potential side effect. This is especially true at higher doses, which can increase the risk of arrhythmias, particularly in patients with existing cardiac conditions. So in the question stem, they're gonna tell you this patient presented, to the ED or somewhere else, and EKG showed a QT prolongation, and they're gonna ask you which of the following medication the patient is taking is likely contributing to this, and that would be citalopram. And the way I remember this, citalopram sounds like cite something, and I would say cite the QT prolongation. So if I think of QT prolongation, I was like, who cited that? Citalopram. What is the major contraindication for using fluoxetine? So the major contraindication for using fluoxetine is concomitant use with monoamine oxidase inhibitors, as it can lead to serotonin syndrome, a potential life-threatening condition. Fluoxetine and MAOIs should not be taken together. What lab tests are needed when taking Valproate? So you're going to be needing a liver function test, complete blood count, CBC. You're going to do this to check for thrombocytopenia, and Valproate serum levels to ensure therapeutic efficacy and detected toxicity. If they want to get creative, they can ask you the following labs, which one is not needed for Valproate, and that would be the option that is not liver function test, CBC, and Valproate serum. So remember these three tests for labs when taking Valproate. What is the mechanism of action of MOA of Valproate? So Valproate works by blocking voltage-sensitive sodium channels, stabilizing neuronal membrane, and increasing GABA concentration in the brain, which has anticonvulsant and mood-stabilizing effect. Voltage-sensitive sodium channels. Block those, you got your Valproate mechanism of action. What are the signs of lithium toxicity? They love to ask questions about lithium because it's all over emergency room, ERs, farm questions, psych ERs, no lithium side effects. So the signs of lithium toxicity include tremors, vomiting, diarrhea, confusion, drowsiness, and muscle weakness. Severe toxicity can result in seizures and coma. So signs of lithium toxicity: seizure, coma, muscle weakness, confusion, think lithium. Which medication should not be combined with lithium due to the increased risk of toxicity? That would be the NSAIDs, like ibuprofen. They can increase lithium levels and the risk of toxicity by reducing the renal clearance. So if you are prescribing lithium, they're going to ask you in a question stem which of the following medication you should advise patients stay away from to reduce the risk of toxicity, and the answer is NSAIDs. How does dehydration affect the lithium levels? Dehydration can lead to increased lithium levels and a high risk of toxicity due to reduced renal clearance. So lithium is all about kidneys. Avoid the NSAIDs. Stay hydrated. What are the common side effects of lithium? Know this question, memorize this, you will see this on your exams. Common side effects of lithium include tremor, weight gain, polyuria, polydipsia, and hypothyroidism. Here's a little chart. Lithium side effects: core mnemonic is lithium, lethargy, increased urination, tremors, hypothyroidism, impaired cognition, urine retention, metallic taste. So they can list different side effects and they can ask you which of these is not associated with lithium side effects. So knowing this mnemonic will help you eliminate that and get the question right. Or they can give the side effects and say which of the following medication is likely to cause. Knowing the lithium mnemonic can help you remember everything you need to know about lithium side effects. What test is required before starting the lithium? And that would be your baseline kidney function test, BMP. Creatinine, BUN, and thyroid function test, TSH, are required before starting lithium. So, as we remember earlier, lithium is all about kidneys. It can also cause hypothyroidism. So, you want to check the kidneys and you want to check the thyroid function test before you start patients on lithium. What is the main contraindication for using lithium? Severe renal impairment. So again, if this is somebody who has messed up kidneys, you probably don't want to give them lithium, which can increase the risk for lithium toxicity. What is the common side effect of the long-term lithium use? A long-term lithium use commonly causes hypothyroidism and may lead to the nephrogenic diabetes insipidus. Again, TSH and check the kidneys before starting lithium. What is the mechanism of action of lithium? Lithium works by increasing serotonin and norepinephrine receptor sensitivity. This stabilizes mood and helps reduce the frequency and intensity of mood swings, particularly in conditions like bipolar disorder. What can lithium use during pregnancy lead to? This is a question you will likely encounter during the rounds, during your psych rotation, or during your exams. And knowing that lithium used during pregnancy can lead to the Epstein anomaly, which is a congenital heart defect where a tricuspid valve is malformed and displays downwards into the right ventricle, impairing the heart function. So the question stem can say this is, a pregnant patient that had a normal childbirth and now baby presents with the heart issues, and they're going to ask you which of the following medication the mother was taking is likely the cause of this, and look for lithium. Lithium, Epstein anomaly during pregnancy. Which antidepressant is known to be sedating and often prescribed for insomnia? That would be trazodone. This is an antidepressant known for its sedation effects, and it's usually prescribed off-label for insomnia, even though its primary use is to treat depression. What is a serious potential side effect of taking SSRIs with NSAIDs? And that would be the GI issues, GI bleeding. So NSAIDs in itself increase the risk for GI bleeds, and when paired even further with SSRIs, it can make it even worse. SSRIs plus NSAIDs equals GI bleeding. Which SSRIs have the lowest sexual side effects? That would be citalopram, fluoxetine, and escitalopram. They are known to have the lowest side effects, and if the patient is worried about side effects of sexual dysfunction, consider these three. Which SSRI is the safest in pregnancy and breastfeeding? That's a great test question. So they're gonna tell you the patient is pregnant or they're breastfeeding, but they also got, postpartum depression or something else, and you want to treat it with medication, and they're gonna ask you which of the following medication is the best choice, and that would be sertraline, which is preferred in pregnancy and lactation because of the favorable side effects and the cardiac profile. So again, I would say sertraline is safe for the stork. So, or I'm certain that sertraline will help for pregnancy and lactation. Which SSRI is FDA approved for bulimia? Again, fluoxetine. Clean, very frequently prescribed. At higher doses is effective for bulimia in addition to depression. Fluoxetine fixes the food binges. So again, anything to do with food, I think fluoxetine, I don't feel like eating. I just don't feel good, so I'm not gonna binge. And I think fluoxetine has anything related to bulimia. Which SSRI is associated with the highest risk of withdrawal symptoms? That would be paroxetine, due to its short half-life. So the shorter half-life, which intensifies its withdrawal symptoms if stopped abruptly. Paroxetine, increased risk of withdrawal symptoms due to the short half-life. Which antipsychotic requires routine CBC monitoring due to the risk of agranulocytosis? That would be clozapine. The most effective antipsychotic for resistant schizophrenia requires weekly or monthly CBC checks. So the question stem, they're going to tell you this is a patient that has a schizophrenia, which has been resistant to other treatments, and they're going to ask you, what medication would you like to prescribe? And the answer is clozapine. Or they can get really creative and you say, you are treating a resistant schizophrenia with clozapine. Which of the following tests should be ordered for this patient? They're going to list 4 different options, and the answer is weekly or monthly CBC checks. Clozapine, close watch on CBC. Seeing clozapine for CBC. Which SNRI is also FDA approved for fibromyalgia? And that would be duloxetine. Treats depression, diabetic neuropathy, and fibromyalgia. Duloxetine does double duty. Which atypical antipsychotic is best for treatment of resistant schizophrenia? We already covered this. It's clozapine. It's a gold standard for resistant schizophrenia. Clozapine closes the case. All right, so that brings us to the end. I hope you find these questions very helpful. Thank you for watching this. Thank you for all beautiful comments, and I will see you guys in the next video.